Common diseases diagnosed in anatomical pathology. Anatomical pathology plays a crucial role in diagnosing a wide variety of diseases by examining tissues, organs, and cells to identify structural changes caused by disease processes. The following are some of the most common diseases diagnosed through anatomical pathology. 1. Cancer neoplasms. Cancer is one of the most significant diseases diagnosed through anatomical pathology, particularly through histopathological and cytopathological methods. Pathologists examine tissue samples to determine the type, grade, and stage of the cancer. Tumors can be benign, non-cancerous, or malignant cancerous, and histopathology helps in identifying the cellular abnormalities, invasion into surrounding tissues, and metastasis, spread to other parts of the body. Common cancers diagnosed through anatomical pathology include breast cancer, lung cancer, colorectal cancer, prostate cancer, skin cancer, melanoma. 2. Infectious diseases. Anatomical pathology is essential for diagnosing infections caused by bacteria, viruses, fungi, and parasites. Pathologists examine tissue samples or body fluids to identify the causative organisms and assess the extent of infection. This can include bacterial infections, e.g., tuberculosis, pneumonia, and abscesses; viral infections, e.g., HIV, herpes, and influenza; fungal infections, e.g., candidiasis and aspergillosis; parasitic infections, e.g., malaria and leishmaniasis. 3. Inflammatory and autoimmune diseases. Inflammatory diseases, where the body's immune system reacts abnormally to its tissues, are commonly diagnosed through anatomical pathology. Examples include rheumatoid arthritis, characterized by inflammation of the joints; systemic lupus erythematosus, SLE, an autoimmune condition that affects multiple organs. Inflammatory bowel disease, IBD, includes Crohn's disease and ulcerative colitis, leading to chronic inflammation of the gastrointestinal tract. Vasculitis, inflammation of blood vessels, which can affect various organs. 4. Cardiovascular diseases. Anatomical pathology is used to diagnose cardiovascular diseases by examining the structural changes in the heart and blood vessels. Some of the conditions diagnosed include atherosclerosis, hardening and narrowing of the arteries due to plaque buildup; myocardial infarction, heart attack, damage to the heart muscle due to reduced blood flow; cardiomyopathy, disease of the heart muscle, often leading to heart failure; endocarditis, infection of the heart valves. 5. Neurological diseases. Neurological disorders are also diagnosed through anatomical pathology, especially in cases of brain and spinal cord diseases. These include neurodegenerative diseases, e.g., Alzheimer's disease, Parkinson's disease; stroke, brain tissue damage due to lack of blood supply; brain tumors, both primary and metastatic tumors in the brain; multiple sclerosis, an autoimmune condition that affects the central nervous system. 6. Renal diseases. Pathological examination of kidney tissue helps diagnose a variety of renal diseases, such as chronic kidney disease, CKD, progressive damage to the kidneys, often from diabetes or hypertension; glomerulonephritis, inflammation of the kidney's filtering units, glomeruli; polycystic kidney disease, inherited disorder causing fluid-filled cysts in the kidneys. 7. Liver diseases. The liver is often examined in anatomical pathology to diagnose various diseases, including hepatitis, inflammation of the liver, often caused by viral infections, e.g., hepatitis B or C; cirrhosis, scarring of the liver tissue, often due to chronic alcohol use or viral infections; liver cancer, hepatocellular carcinoma, which can arise from chronic liver disease. 8. Endocrine disorders. Anatomical pathology is also used to diagnose diseases of the endocrine glands, which secrete hormones. These include thyroid disorders, hypothyroidism, hypothyroidism, and thyroid cancers; adrenal diseases, conditions like Cushing's syndrome or adrenal tumors; pituitary tumors, abnormal growths in the pituitary gland affecting hormone production. 9. Hematologic diseases. Diseases affecting the blood and bone marrow are diagnosed through pathological examination of blood samples or bone marrow biopsies. Common conditions include leukemia, a type of cancer affecting blood cells, often diagnosed by examining bone marrow and blood smears; lymphoma, a cancer of the lymphatic system. Diagnose by examining lymph nodes or other affected tissue. Anemia, reduced red blood cell count or hemoglobin, identified by examining bone marrow or blood samples. 10. Genetic and metabolic disorders. Genetic disorders and metabolic conditions are also diagnosed by analyzing tissue and cellular structures. Some examples include Down syndrome, a genetic condition diagnosed by analyzing chromosomes. Cystic fibrosis, a genetic disorder affecting the lungs and digestive system. Mitochondrial diseases, disorders caused by defects in the mitochondria, which affect energy production in cells.